Hey guys, welcome back to the channel and greetings from sunny Polish countryside. If you're like me, working remotely and spending a lot of time in a seated position, and maybe you're also cycling and running or squatting, you may be dealing with tight hip flexors. So today we are breaking down the two hip flexors, the psoas and the quads, specifically rectus femoris, which is one of the quad muscles that crosses the hip. And those two may be the generators of pain, discomfort, and pulling in the front of the hip. So let's take a look at the anatomy. Psoas, see attachments to the lower back, front of the hip. Rectus femoris, from the pelvis all the way across the knee to your tibia. So you can see that problems with the psoas, tight psoas, can cause discomfort in lower back pain even, while quadriceps can cause that sort of tightness in the front of the thigh, but also cause discomfort in the knee. I've seen this in clinic a lot, right? When young teenage boys come into the clinic complaining about lower back pain, where there's actually nothing structurally wrong with their back, but the hip flexors were atrociously tight. Let's get going with the stretches. The first one is the psoas. So step your right foot through and find a lunge. Okay? Feel free to hold onto the chairs, hold onto the wall, or you could even use the dowel if you got it, or a broomstick. Okay? I'm going to use it just so you can see. We'll be using these muscles here, the crease of the left hip. So my right leg is forward. We'll be doing pails, isometric contractions. In the stretch, we'll try to contract the muscle for a few seconds and then relax. So you've got that post-contraction relaxation. So first stretch. If it's okay in your lower back, stay like this. You want to stay pretty upright with the tailbone tucked under. But you can also lean forward a little bit, and instead you could place your hands, let's say, on two blocks and be with a little bit flatter back if this feels better, as long as you feel the psoas on the left side lengthening. So I'm going to stay here, and let me explain what we're doing. We're not doing it yet, okay? So I will say breathe in, and then drive your knee forwards like you're trying to do this motion. Okay, so your psoas will contract and your thigh bone will go forwards like you're trying to bring your thigh to chest. We're going to do it 3 times, okay? So locate the stretch, breath in, and then drive that left leg forwards like you're trying to lift the knee to chest for 5, 4, and again, the contraction is very low, right? Like 30%, 3 out of 10, 2, 1, and then relax. So it's post-contraction relaxation. So again, breath in, and then gently drive that left leg forward. You may actually see or feel how your pelvis moves back a little bit as a result. And again, 3 out of 10. Give me 3 more seconds. 2, 1. And then deeper stretch. I'm letting my pelvis go down. I'm tucking my pelvis under more. And 1 more. Breath in. And then drive. 5 forwards. Contracting through the front of the left hip. Maybe 4 out of 10 now. And 3, 2, 1. And release. All the stretches for 2 or 3 breaths. And then slowly push back. So push with the front foot. So we out of this position. We step left leg forward. Again, I would really suggest using a dowel for this one if you got a broomstick or any other stick. And we're locating a stretch. So stretch to the front of the right hip. You can obviously use anything else. You can even use a roller and put your forearm on the roller. You can place a chair in front of you or on your side. So again, it's not going to be just passive stretch. We're trying to create activation in the muscles to, again, influence the muscle neurologically, right? Be able to contract it in a stretch position and then give it even more length. So, breath in. And then you're driving your right thigh forwards, trying to go forwards and trying to pull the right thigh towards your chest. For 5, 4, 3, 2, 1. And I will try to go a little bit deeper, maybe another inch, maybe half of an inch. Make sure you're again feeling the stretch the front of the hip and not just compression in the lower back. You can always lean forwards if needed. Breath in. And we go on again, driving that right thigh forward. So you should again feel that contraction, the crease of the hip. So just 3 or 4 out of 10, and 3, 2, 1, and then relax. Building up to the last drill. Find the stretch, breath in, and then we're contracting gently, pushing thigh forward and up. Thinking of this trajectory of the leg this way, and 3 more, 2 more, 1 more, and then stretching 1 more time. So this one will be your deepest stretch for today. Again, it can be painful if your psoas is very tight or very weak, and you may feel like this is actually an agony. And we're pushing with the front foot, sending pelvis back. Okay, next setup for your quadriceps, specifically for quadricep, but specifically for the rectus femoris, okay? Couch stretch. Just bear in mind, if you've got any knee issues or ankle issues, those setups may not be ideal, so you may have to do it standing or side lying to protect your knee, protect your foot, but give it a go. Try the modifications or the full setup and let me know how you get on. Position without using any equipment, which will be support your kneecap because of obviously weight bearing. See if you can pull your heel to the hip. If you can't do that, of course, you can use the strap, right? And pull your foot here or even here. It's a bit of work though, okay? You want something a little bit easier to work with, not strong stretch either way. You can go here, but it's again not as deep, right? Because your foot can relax. So this restriction in the ankle, you just go here and you tuck your pelvis under. For the strongest stretch, so in this couch stretch, we aiming to stretch quadriceps, okay? One of them actually mostly, which crosses the hip and the knee. So you will try to get upright as you can, with pelvis tucked under, leaning back to the wall. And you could even rotate towards the side of the front leg. Hold on to something, and I'm turning to my right, and I'm stretching my left quad. Comfort for the knee is obviously priority. Knee and foot, right? If you feel like something else than the hip and thigh is giving you trouble, then you want lust in a stretch, okay? It's absolutely fine to, even on the other side, do it slightly differently. Maybe you're just somewhere there, you're not fully sending the leg back, maybe that's enough. So again, you're trying to first locate a stretch sort of between the hip and the knee, and even on top of the knee, because that tendon goes all the way down to the lower leg. And then maybe twisting towards the side of the front leg. I'm not moving the leg itself, I'm just turning my spine, and I'm going backwards at the same time. You will feel it when the stretch is a little more intense. And again, we want a couple of minutes here. And this is position for a stretch. And you can absolutely stay here. Or if you want more and your feet are okay, or left foot is okay, you can try going here, okay? And tucking pelvis under. And that would apply to both setups, as you want to open the hip flexors and stretch the quads. Alright, so origin moves away from insertion. I'm going to pull. So you can bend the bottom leg if you want to, or you can straighten it. Pull your heel to the sit bone and send your thigh bone back. We're trying not to send the leg up. We're keeping knee hip level. Okay, so this is like the most basic stretch for your quads, which again, if quads are tight, you will feel it immediately. Now, if this position is sort of so-so, you're not feeling much, you can put your foot outside your hip and then return onto your back. And you can use the ground to help you with this, okay? You will be tucking your pelvis under for this one. All right, guys, that's it for today. Thanks for joining me. I will see you soon. I will bring you a little bit more theory, a little bit more explanations, follow-alongs coming soon.